Hi. Um, give me just a couple seconds so I can get the presentation set up. This is my very first time, so I'm a little nervous.
No problem.
Do what?
Ask them if they can see your
Can are you guys able to see my screen?
Not yet, no.
Okay.
You'll have to hit the green button at the bottom of your screen that says share.
Okay. What about now?
Yes, now we can see it.
Okay.
Well, it's already open. So when you do share screen, it should have popped up on whether you wanted that one open or that one. Yeah, share that one or that one. You should share this one. We did. We did. So I don't know what we can see though. Wrong screen.
Is it sharing?
It's sharing this one. So exit out of everything but GoToMeeting real quick.
Okay.
Just let's start fresh.
Okay.
And we'll pull it up. Okay. Try. Okay, now click this. And then so minimize this. Nope, undo that. Minimize the whole PowerPoint. And then you should have a GoToMeeting. There should be a place in GoToMeeting where you share your screen. So click here. I don't know what's happening here.
I don't know either.
You're sharing your screen.
I have no idea what I'm doing here.
Starting over. Stop. Okay, and then hit share again. And then you should try this one. Oh, wait, maybe that one. That's what we did before.
That looks good.
Right? Okay.
Okay. Got it?
Yep.
Got it.
Okay.
Now where are your notes?
Now I don't know. Okay. Where are my notes? Can I open this?
Yeah.
Okay. What if I do a slideshow? Oh, my notes are just right there. Okay. But how do I move this?
You need to use your mouse or your keyboard.
Okay. Just my arrow
Yep,
buttons.
should work.
Okay.
We'll test it just real quick. I don't know why. Okay, resume slideshow. Nope, nope. Yeah. Okay, try that. Okay.
Okay.
All right. Awesome.
Okay. I think we got it now. Can everybody hear me okay?
Yep, we can hear you.
Okay. Well, good afternoon. My name is Dawn Arkinson, and I'm here today with Brenna Lanou, and we work with the Great Plains Breast and Cervical Cancer Early Detection Program. Today, we will be presenting cervical cancer basics and talking about the basics of cervical cancer. Please keep in mind, however, that we are not providers or health experts. Also, please hold your questions until after the presentation. Honor Every Woman is making preparations for Cervical Cancer Awareness Month. We have developed and implemented a culturally appropriate social media guide for our organization and other stakeholders to utilize. This social media guide includes Facebook and Twitter recommendations and is available For all of our partners that are interested in increasing cervical cancer screening and HPV vaccination rates in American Indian and Alaska Native communities. You can visit our website to request this as a resource if you're interested. In addition to developing this social media guide, Honor Every Woman is working to schedule screenings of the Someone You Love, the HPV epidemic documentary in Nebraska, South Dakota, and Iowa. We are scheduling a Wear Teal Day within our organization. Our goal for this webinar is to give an introduction to cervical cancer. This will allow you to discuss the basic relationship between HPV and cervical cancer, relay the importance of screening guidelines for women, and to help spread the word about how to reduce individual and systemic risk factors for cervical cancer. This year, Great Plains Tribal Chairman's Health Board was awarded a grant to help increase the breast and cervical cancer screening rate in the Great Plains. Our objective is to provide breast and cervical cancer screenings to low-income American Indian and Alaska Native women in North Dakota, South Dakota, Nebraska, and Iowa. Women eligible for our program include women whose income falls below 250% of the federal poverty level, who are uninsured or underinsured, and are 21 to 64 for cervical cancer and 40 to 65 for breast cancer. Women under 40 must be symptomatic or have a family history of breast cancer. Oops, sorry. These are the program goals that the Great Plains Breast and Cervical Cancer Early Detection Program will be working on within the Great Plains tribes in the 4-state area by increasing screenings for breast and cervical cancer. To increase these screenings is to work with the tribes in these areas by giving them assistance. This would be able to help them increase evidence-based interventions, which are called EBIs. There are 3 EBIs that we will be focused on. The first one is increasing client demand. This one is done by client reminders, group education, one-on-one education, and using small media. The second one is increasing client access, which is done by reducing structural barriers such as transportation costs and reducing out-of-pocket costs. The third one is increasing private provider delivery, and this would include provider reminders and provider assessments. Some of our other program goals are to increase appropriate breast and cervical cancer screenings, rescreening, and surveillance among American Indian and Alaska Native women in the Great Plains area. Also to increase the use of evidence-based interventions, like I already talked about, increase a healthy lifestyle behaviors to also reduce cancer risk, enhance informed decision-making around breast and cervical cancer screening, also to reduce breast and cervical cancer morbidity and mortality among American Indian and Alaska Native women in the Great Plains region, and also to reduce disparities in breast and cervical cancer incidences and mortality in the Great Plains regions. At each stage in our program, BSEP focuses on screening, obtaining diagnostic services, and referring treatment services when necessary. In doing that, we focus on 3 aspects of obtaining medical assistance: the patient, the health system, and the communities in which these 2 entities interact. BSEP is working on reducing structural barriers that stand in the way or complicate eligible women's access to breast and cervical cancer screening. BSEP is utilizing patient navigation to complete this piece, as well as implementing evidence-based interventions at a health systems level, like creating and promoting screening reminders to be utilized in the community. In addressing how the patient and the health systems work together, we must address the community, and we do this through educational campaigns, social media involvement, and listening to the demand and needs of the community in order to increase access to breast and cervical cancer screenings. Here we have the health systems changes, which includes direct screening, patient navigation, and evidence-based interventions. The screenings will consist of mammograms, Pap smears and Pap tests, clinical breast exams, also called CBEs, diagnostics. In patient navigation, there are two groups of women when it comes to patient navigation. Those that are eligible to receive program paid screenings, and then there are low-income women who are insured. It is our program goal to focus on women who might not get screened otherwise. Patient navigation is used to reduce the barriers to screening and provide follow-up, as well as navigating women to the appropriate location to be screened. Comprehensive navigation includes assessing barriers and resolving barriers, providing education and support, tracking and follow-up to women who have been screened or will be getting screened, multiple contacts between patient and navigator, identify the outcomes of the patient navigation. And then the EBIs, reducing structural barriers such as providing transportation, provider reminder systems, and increasing client demand by providing client reminders, group education, one-on-one education, and small media. And now we go into our cervical cancer basics. The information that we have here is from the CDC, which is the Centers for Disease Control. What is cervical cancer? Cervical cancer is a highly preventable due to screening tests and vaccination to prevent the Human Papilloma Virus, which is also known as HPV. Cervical cancer develops slowly and begins with a precancerous condition known as dysplasia. Dysplasia is easily detected in a routine Pap smear and is completely treatable. Cervical cancer is a malignant tumor deriving from cells of the cervix. Cervical cancer is typically detected well before a woman recognizes any symptoms. But if a woman foregoes regular screenings, cervical cancer can go undetected and advanced stages where a woman may discover that she has the following symptoms. These are a list of some of the symptoms: bleeding that occurs between regular menstrual periods, bleeding after sexual intercourse or a pelvic exam, menstrual periods that last longer and are heavier than before, bleeding after going through menopause, increased vaginal discharge, and pelvic pain. There are many potential causes for these symptoms, so it is vital that if a woman is experiencing any of these, that she discuss them with her doctor. Cervical cancer is the second most diagnosed cancer in women worldwide. However, it is extremely preventable through the practice of regular screening. Overall, American Indian women are nearly twice as likely to be diagnosed with cervical cancer as white women. This disparity continues to grow as we focus on the mortality rate from cervical cancer of American Indian and Alaskan Natives nationwide to the region in which the Great Plains is contained. In the Northern Plains, American Indian and Alaskan Native women die from cervical cancer at a rate that is 4.2 times higher than whites. These numbers indicate a huge necessity for the increase in breast and cervical screening in the Great Plains. In our 4-state service area, currently facilities are reporting a 46% screening rate across North Dakota, South Dakota, Iowa, and Nebraska combined. The national screening average for all races is 83%. This disparity needs to be eliminated, and American Indian women and their families no longer have to suffer from cervical cancer. Our program will address both the health system issues and individual risk factors that contribute to a cervical cancer diagnosis. So these are some These are some the risk factors versus causes. A risk factor is any attribute, characteristic, or exposure of an individual that increases the likelihood of developing a disease or injury. A risk factor is not necessarily a cause. So some of the risk factors are a woman has an increased risk of developing cervical cancer if any of the following are true. If she has HPV, which causes nearly all cervical cancers, and two types in particular are attributed to nearly 70% of all cervical cancer diagnoses. If she smokes, if she has HIV or any other condition that may make it harder to fight off an infection, if she has had a prolonged use of birth control pills, and if she's given birth to 3 or more children, and if she's had multiple sex partners. Achieving and maintaining a healthy weight can reduce your risk of most cancers, including cervical cancer. One way to do this is to ensure that you are incorporating 30 minutes of moderate activity into your daily schedule. Great Plains Tribal Chairman's Health Board's Community Health Prevention Team has many resources for educating individuals on how to accomplish this. Contact our Chronic Disease Self-Management Education Program for details. Next, limit your use of alcohol intake. Currently, it is recommended that women not exceed 1 alcoholic beverage per day and men not exceed 2 alcoholic beverages per day. But the best course of action is to avoid alcohol completely. This is the case for most commercial tobacco as well. The relationship between lung cancer and tobacco use is widely known, but commercial tobacco use plays a role in the development of nearly all cancers. Quitting commercial tobacco as soon as possible if you use it will greatly reduce your risk, but ensuring that you advocate for commercial tobacco-free lifestyles will aid the next generation in reducing their risk before it becomes an issue. Waiting to have sex until you are older can help you avoid HPV. It also helps to limit your number of sexual partners and to avoid having sex with someone who has had many other sexual partners. The most effective way to reduce your risk of cervical cancer is to get the HPV vaccination at the recommended time. We will discuss additional HPV vaccine recommendations later in the presentation. If individuals are sexually active, they should ensure that they are practicing safe sex. This not only reduces their risk of contracting cancer-associated HPV, but also reduces the risk of contracting HPVs that can cause genital warts as well as other STDs. The best way to reduce your risk is to get screened. This means women should get a Pap and HPV test as recommended. Some of these risk factors you cannot change, like sexual history or having a compromised immune system due to a chronic condition. Even though you may have many of these risk factors, screening can help mitigate them. Follow screening guidelines and do what you can for your overall health, and you will be able to reduce your risk of cervical cancer. The number of sexual partners that a woman has had can increase her cervical cancer risk because it increases her risk of getting HPV, and in turn, this increases the chance of contracting cancer, a cancer-causing type of HPV. While most HPV types clear up on their own over the course of a couple years, in the case of cervical cancer, the oncogenic types develop into cancer over the course of 7 to 10 years. Regular and timely screening is essential in order to combat other invariable risk factors. Cancer-causing types of HPV can also cause genital warts. You can pass HPV to your partner when you are asymptomatic. Age at first sexual experience can contribute to cervical cancer risk, as well as beginning sexual activity before the age of 16 has been shown to increase cervical cancer risk. If your current partner has had a previous sexual experience with someone with cervical cancer, they could have been exposed to a cancer-causing type of HPV. Even with condom use, HPV can affect areas around the genitals that are not protected by a condom. In addition, if a woman has had her first full-term pregnancy prior to the age of 17, her risk is increased. While an individual's sexual history is not the only determining factor whether or not they are at risk for cervical cancer, it is important to be aware of the role that your sexual history may play in your risk. Becoming knowledgeable about this can help inform your screening schedule and patient-doctor relationship. Informing your healthcare provider about your sexual history and becoming aware of how it affects your cervical cancer risk puts you in charge of your health and gives you the power to do all you can do in preventing cervical cancer. What should you do now that you know about cervical cancer's risks and incidents? Get screened and share this with other women who may be unaware. Routine screening offers the best way to find cervical precancers, which can be treated to keep cervical cancer from developing. It's also the best way to find cervical cancer early, when it's small and has not spread. Finding cancer early gives you a better chance for successful treatment. According to the National Cervical Cancer Coalition, deaths from cervical cancer in the United States continue to decline by approximately 2% a year. This decline is primarily due to the widespread use of the Pap test to detect cervical abnormalities and allow for early treatment. Most women who have abnormal cervical cell changes that progress to cervical cancer have never had a Pap test or have not had one in the previous 3 to 5 years. According to Dr. Lois Raymondetta, 50% of women diagnosed with cervical cancer have never had a Pap smear. How a woman can prevent cervical cancer changes throughout her lifespan. The best way to prevent cervical cancer is to get vaccinated in adolescence. Individuals can get vaccinated through the age of 26 for women and 21 for men, but the vaccine is most effective at 11 to 12 years old. At 21, a woman should start to get her Pap test every 3 years. No HPV testing is necessary at this age due to the virus's ubiquity. Sorry, I don't know how to pronounce that word, and the natural process of the virus. Most women have a non-oncogenic form of HPV in their 20s, and it typically clears up on its own. Once a woman enters her 30s, she should begin co-testing every 5 years. This is when a woman receives a Pap test and an HPV test. Since cervical cancer is most often found in women over the age of 30, this is when the cells that are infected most likely begin to change or become infected. Cervical cancer develops very slowly from 7 to 15 years and is best caught when regular testing is done. There are cases when your physician may not require you to receive the HPV test. In this case, you will continue triennial Pap testing. After 65, cervical cancer risks drop dramatically and testing is no longer necessary. So what is a Pap test? A doctor will collect cells from the surface of the cervix to be tested for any changes or abnormalities. Early detection via Pap test allows the doctor to require further testing or to remove abnormal cells. A pelvic exam is not the same as a Pap test. A Pap test will test cells of the cervix for changes, and a pelvic exam is when a doctor checks the health of your reproductive system. A Pap test can be considered a part of a pelvic exam. You can only receive a Pap test at a clinic or doctor's office compared to the options in breast cancer screening where mobile options exist. After a Pap smear and HPV test, there are several types of results you can receive. The first result listed here is an abnormal Pap smear with an HPV positive result. Atypical squamous cells are the most common abnormal finding in Pap tests. The Bethesda system divides this category into 2 groups, ASC-US and ASC-H. HPV is a sexually transmitted virus that can cause genital warts and is attributed to 6 types of cancer. Perhaps the most well-known link between STD and cancer is that of cervical cancer and HPV, also known as Human Papilloma Virus. HPV is an extremely common sexually transmitted disease. In fact, it is estimated that 79 million individuals are infected with HPV in the United States currently. Often referred to as the common cold of STDs, this virus is left unmonitored and can lead to cancers and genital warts. HPV and cervical cancer. About half of the sexually transmitted HPVs are associated with cervical cancer. There are over 100 types of HPV and 40 types that are associated with sexual activity. 70% of cervical cancer cases can be attributed to 2 types of the virus. HPV 16 and HPV 18 are often referred to as high-risk HPV types. In addition to types 16 and 18, types 31, 33, 45, 52, and 58 are also cancer-causing high-risk types. Teen boys and girls who did not start or finish the HPV vaccine series when they were younger should get it now. HPV vaccine recommended for young women through age 26 and young men through age 21. Talk to your doctor about your eligibility. An HPV test differs from a Pap test in that the Pap test looks for changes in the cells, and an HPV test tests the cells for high-risk HPV types. Both are necessary for preventing cervical cancer because the HPV test can help the doctor determine if further more invasive testing is needed. So this is a diagram of what the HPV, where the HPV tests and where a Pap test, what a Pap test tests. So women under the age of 21 should not be screened regardless of the age of sexual initiation or other risk factors. And that means being screened for cervical cancer. Their regular Pap test should begin at age 21 to 65, and they should have them every 3 years. Co-testing, which is the HPV and the cervical cancer screening, should be done for women ages 30 to 65, and that should be done every 5 years. The results can take up to 3 weeks. If the test shows something that isn't normal, your healthcare provider will contact you and figure out how best to follow up. If a test shows cells that are not normal, your healthcare provider will let you know if you need to be treated. So this is some of the resources that we have here. And if you need further information on our program on breast and cervical cancer, or to request educational materials like the ones listed on this slide, please contact Kelly LeBeau, and her email address is Kelly, K-E-L-L-E-Y .LEBEAUX@gptchb.org. And if you want to sign up for the newsletter, you can visit our webpage and to submit events for the events calendar email. So we have brochures for cervical cancer, we have a brochure for breast cancer, and we have a brochure for our program. And then we also have fact sheets available, which talks about the HPV vaccination, cervical cancer, and breast cancer. We also have fact sheets that talks about the myths of those three? And that's it.
Thank you, Dawn, for sharing that presentation. Does anyone at this time have any questions for Dawn? Please keep in mind, if your computer does not have a speaker, you can type your questions into the chat box and I will read them for you. While if anyone is thinking of a question, I am putting an evaluation link into the chat box. If you could please fill that out, it's very helpful for us. And brief.
Hello, can you hear me?
Yes, Deborah, go ahead.
Oh, hello, this is Deborah. I have a question. Could you clarify the HPV vaccination does not cure genital warts?
Yes, that's true. What exactly is your question?
Oh, I just wanted to clarify. Yes, it does cure genital warts, or it's not a cure for genital warts?
It is not a cure for genital warts.
Okay, thank you.
Thank you for your question.
May I ask a question? Hi, this is Carlos.
Hi, Carlos, go ahead.
Hi, are you guys doing any awareness via like the upper elementary schools in the tribal communities, or in the youth program, say for kids like 5th grade and older?
No, we haven't started doing anything like that with that age group that I'm aware of. Brenna?
Hi, can you guys hear me?
Yeah, we can hear you.
Okay. So we've talked as a program, we've talked a lot about maybe talking to kids, but the youngest we've ever really tried to educate is maybe high school, because we really don't want to overstep our bounds when it comes to the kids' parents and stuff. But it's definitely something
Sure.
we are always thinking about. And as far as the majority of what our program does is we tend to focus on women ages 21 to 65, because that's where we can, I think, get more impact.
So at that other age level that I just mentioned, and probably most culturally appropriate would be like more passive awareness, such as flyers and information, versus being more overt and directly presenting the information in, say, the classes, would you say?
Right, yeah.
Thank you.
Thank you for your question.
Hi, can you guys hear me?
Yes.
Okay, what did you say, which day is the Cervical Cancer Awareness Day?
We did not say.
Okay.
I don't. Brenna?
We actually just scheduled our own, or just decided which day it would be for Great Plains. And I think we decided on January 24th. But the American Indian Cancer Foundation also hosts a Turquoise Tuesday. And I don't know exactly what day that is, but you can find that information on American Indian Cancer Foundation's website.
Thank you.
Thank you for your question.
If there are no other questions for Dawn or Brenna, I would like to leave everyone with just a few reminders. Our next webinar will be on February 12th, and it is titled Living Healthy, and it will be about heart disease and stroke. And our presenters will be Chrissy Meyer from the American Heart Association and Rachel Fair from the South Dakota Department of Health. and we will be sending out a calendar invite and flyer for that soon. If you are new to these webinars, if you could please put your first and last name along with your email in the chat box. That way we are able to keep in contact with you and send the recording to this webinar and invitations for any upcoming webinars. And with that, if there are no other questions, we can stay on for a little longer if there are any last minute questions. Otherwise, I would like to thank you all for joining us today, and have a good day and Happy New Year.
Thank you.
Thank you, Dawn. That was a great presentation. You did good.
Thank you.
Yeah, thank you.